Welcome, everyone. We're just going to give it an extra minute. Other people are in the lobby, so they're being admitted now. So it's good to see you all. Question for you, George Margellis in Australia. Did you follow up and wear your pajamas for this, given this that time of the night?
Good morning, Brian. No, not in my pajamas.
Thank God for that, is all I can say. I've seen George in his pajamas, and nobody else should be seeing him. It's not one of those times. What time is it there with you, George?
1:30 a.m.
My God, you're a keen, I tell you.
Look, if it's something you're running, Brian, it's worth getting up for. What can I say?
Oh God, you're so smooth. You know, you obviously went to the same school as I did. Anyway, it's good to see you. Hi, Angela.
Hi, Angela.
Hi, nice to meet you all. Hi.
And you are in India at the moment, are you?
Yes,
Angela,
yes, Manipal. Yes.
Great. Well, meet Rahendra, who's on the call as well, who's in, where are you?
Delhi right now.
In Delhi.
Yeah, yes, yeah. Nice to meet you. Nice.
Indeed. Right. So we're waiting on Heather's admitting people as fast as she can. So just give it another minute, we'll be fine.
Hi, Anne.
Good morning and Happy New Year.
Happy New Year to you too.
Oh, yeah.
It's the first we've seen each other in person.
Yeah.
A few more people coming in.
Yeah.
Morning all.
Morning.
Early morning, California.
By God, you've got up as well.
Morning,
what time
John.
is it there, John?
This is 6:30. And there's
You're
a beautiful
out walking,
California sky for you in the morning at 6:30.
Oh, very nice. Very nice.
Good sun, that's an amazing thing.
Yeah, I'm on my morning walk, so I'll keep off video, I think.
Yes, it is a bit sort of, it reminds me of when I do exercise, which is not as frequent as it should be, and that I don't want to be reminded. Right, Heather, I think we're ready to go, are we? I think we should start.
Yeah,
others will join us.
Coming in, but let's just go. Hi, Jefferson.
Jefferson, good to see you. All the way from, where are you now, in Brazil?
Yes, in Brazil, São Paulo. Nice to see you all. Happy to be here.
Oh, you've changed your background. The last time I saw you, were sitting on a balcony or a veranda.
Yeah.
That was just to wind me up.
Yeah, just workplace now.
Ah, God, we all have to back to work. Great. Well, look, I think we'll get started. If anyone else is able to join, it'll be great as we move along. So, first of all, welcome to all of you, and welcome to our council members, and also to our partners from around the world, as you can gather. We have allocated a maximum of 1 hour for this meeting because we know you're all busy. If we finish earlier, we'll finish earlier. George can go to bed, and the rest of us can go back to work. And we have an agenda which has already been sent out to you. I think you can have a look at it. The key to this is that since we started this, interesting enough, almost 2 years ago, March of 2020, because of the pandemic, this is why we started this, we have found that it keeps growing, and more people want to join with us and to assist in the work of the Global Health Connector. So for those who have, maybe it's your first call with us, just to explain that, succinctly put, the Global Health Connector is about connecting health communities globally. In all the work we all do, and many of you have got big global communities and connections as well, I certainly find that whenever I meet people from other parts of the world, I often am amazed how much good work they're doing. And yet no one in other parts of the world have a clue what they're doing. And I find people who have got particular issues or problems they're dealing with, and I say, you do know they've got the same problem in another country. And they go, yeah, we know, we don't have any connections there. So we have found behind the scenes that we've been making really great connections across the world on specifics. And as you all know by now, I'm very keen on specifics. So I just want to say that to welcome all of the new people who are joining us. I see quite a few actually new names and new faces. So I'm grateful to you. So if I may say this, as Heather's already said, if you keep your cameras on, we've only one part of the agenda where there are any slides, and Heather will show those when we get to it. Other than that, we want this to be an open, transparent council meeting. This is not a closed society. This depends on transparency and openness. And the second thing it depends on is you, because we need you in every case to think of the topics we discuss and then decide whether any of what we're doing can be of help to you and your organization. Because remember, we are simply the connector here. So I know a lot of you do a lot of good stuff. I'd like to tell more people about it. You probably would as well. And the second part of that is, how can we help you? And how can we connect you to people you perhaps don't know? And then the last bit is to say, we will specifically ask for your help on a number of these agenda items. So enough chat about that. And all put your hand up, anyone who wants to speak at any moment, and we'll find you. Oh, and by the way, I just wanted to welcome particularly a friend of mine, Jon from Cluj-Napoca in Romania, who goes by the name, which intrigued me at the very beginning when we recruited him as a member, of Fresh Blood.
Thank you very much, Brad.
Jon, you will know, and you should say that that, of course, is in history terms, whatever history it is, was the home of Dracula. And so I thought the name Fresh Blood was really intriguing when they applied for membership. I thought it was one of you trying to con me into announcing the appointment of Fresh Blood as a new member, until we met in Bucharest, Jon, I well remember, and an incredibly active startup network, and now helping us around the world with other startups. So you're all very welcome. The first item, as you'll see from the agenda, is our feeling that whatever messages we have to get them out there. And the simplest way to do that is look at what each of us are doing anyway, and then use each of those events, and we'll come to those in a moment, to promote the message of the Global Health Connector. So I'm delighted to say that in response to a request to our council members, we now have a number of flagship events identified over the next 12, 15 months. And Heather's keeping me right by showing me the screen right away. And if I may, as I go through these, I would like those of you who are on the call, when I ask you to jump in and say a few words about your event. So in the case of Mobile World Congress, I'm just seeing who have we got on the screen who can talk to us about that. Let me just have a look. No, this is something which maybe I can talk to. I don't see Julian yet on the call. Is this maybe Blethyn, could you speak to that one, given you've been so involved in it for so long? Yes.
Yeah, sorry. So
please go ahead.
So very quickly, Mobile World Congress is the global event of the telecommunications industry in Barcelona annually the last sort of 10 years, around about 90,000 to 100,000 attendees in non-pandemic years, takes over the whole city of Barcelona. And because so many of the telephone and telecoms companies are tech businesses like Samsung, there's also a lot of technology there. So we did some what we described as missionary work, trying to educate the telcos about digital health. And a few years ago, we moved to the startup hall called 4 Years From Now. And we continue to try and drive a greater understanding amongst the telcos about digital health and connecting, and increasingly that's getting relevant for things like data, genomics, analytics, that type of thing. So that's a quick introduction to it.
Thank you for that, Blethyn. Obviously, this one comes up very close, 20th of February. We're working on now populating the agenda, and Julian Venn from the Alliance is putting that together. We also have great plans for that, a much bigger event, hopefully in person, globally event for February of 2023. So the next one we have is Vive, and I don't know whether we have Rich on the call yet. I know he was.
Hey, Brian, this is Russ. This is Russ from Chime.
You're here. Lovely, welcome indeed. Please,
one of the few times I've ever made this call, given my crazy world traveling schedule. But
so please introduce yourself, Russ, please.
Hi, everyone. Russ Branzel. I'm the CEO and president of Chime, the College of Healthcare Management Information Executives. Chime for short, because the word's too long. We have a partnership with Health, which runs an amazing conference in the fall. And we now have a partnership on a brand new event called Vive. It's March 6th through the 9th in Miami Beach. We're seeing great response to this new event. It's really designed all around bringing great digital health leaders together. It is not intended to be a big, gigantic 40,000 person expo type event. We're intending it for be a smaller group, leaders, thought leaders, people really trying to drive. I see Ann on the call from the ATA, one of the great partners with Health and with Chime now for this new event. We'll see her and a lot of her leaders there as well. And so you're all welcome. Again, response is great, which is good, but the bad part about that is we're actually getting close to running out of hotel rooms and some space here as things seem to be responding really well for this new industry event in Miami Beach. And for at least for the people in the United States in particular and some other Northern Hemisphere folks, Miami Beach in March, not a bad place considering how cold the winter has been already and plans to be as we move forward. Thanks, Brian.
Thanks very much indeed, Russ. Just on that, I see Rachel's on the call. Rachel is going to be representing the ECH Alliance at Vive in March, and we'll be working with yourself and Rich and Anne and so on to put together our Global Health Connector Summit at that event as well. So Rachel, now you've got a direct contact to Russ, so I leave you and us to put ourselves together.
Oh, friend,
so
don't worry, we'll be in touch.
You'll be in touch. So the next one we're moving on to is ATA. And maybe, Anne, we could ask you to jump in and just give us a synopsis of that event.
Absolutely. So the annual conference and expo is taking place May 1st through 3rd in Boston. As noted, we're very excited about getting back together in person. As Russ noted, the health event this fall, there was palpable excitement in having people together, being able to see each other beyond Zoom. So this is a conference that is going to highlight some of the innovation that's taken place, particularly in virtual care. So I think that you will see a lot that's very interesting, innovative. The ATA itself represents over 400 organizations, ranging from hospital systems to payers on the private sector side to a whole host of solution providers. We're working with Brian and team right now to put together an agenda for our summit, our discussions. And Jefferson has also attended this, and you are all most welcome. We'd love to have you. The more, the better, and the merrier.
Good. Thanks very much indeed, Anne. Next one, Heather. So here we have, so as not to confuse you, this is from the Commonwealth. And Vajira, you're on the call. Do you want to just, I know you're finalizing the date, but perhaps you could just describe the background to your Commonwealth Awards and so on, if you're with us.
Yeah, Brian, thank you.
Thank you very much. Good to see you.
So we've, good to see you too. So we've got our 5th edition of the Commonwealth Digital Health Awards coming up at the end of the last, end of May, in line with the World Health Assembly.
No, eso es una cosa
Final
normal,
awards
¿eh? Para vuestro.
announced in the next few days, and we are currently receiving submissions, so we can submissions can be made through the website of the Commonwealth Center for Digital Health and the awards. It's open to everyone. So the Commonwealth, although the Commonwealth Center for Digital Health is a part of the former British, Commonwealth, the awards are open to anyone. So we accept submissions from all over the world. So please do encourage your members to submit. And I think Brian has kindly shared the information through the newsletter that we circulate. So please do encourage your members to submit and receive and compete for awards.
Good, thank you very much, Vajira. I had the great pleasure before COVID of visiting Vajira and his team in Sri Lanka at the award ceremony then. And I was, as usual, amazed at the amount of innovation there is from across the 54 countries or so of the Commonwealth. And since then, we've been encouraging members. We've had some of our members from Finland, from Slovenia, and others who have entered the awards process over the years. So Andy and myself are working to encourage more of you to submit requests. The purpose of the May, or the date of the May event, will be during the World Health Assembly, which is usually, I think, the last week of May in Geneva. Again, Vajira and I had sessions there a couple of years ago, pre-COVID, and we had close to 20 health ministers from across the world attending the Commonwealth sessions. So we may not be able to do it physically this year, we don't know yet, but we are at least going to have a Global Health Connector Summit and a flagship event listing for these awards to make them available across the world to Commonwealth, but also obviously non-Commonwealth countries. So there'll be more of that in our newsletters and our social media over the next week or two. So you're all encouraged. So that's another one. We then move on to the Digital Health Society, which this year will be held in early October. We moved it, by the way, from November to October, so as not to clash with one of the other flagship events from Health, which takes place in November. So Bledden, can I ask you to do the synopsis of that one, please?
Yeah, okay. So this year will be our 4th annual summit, where we showcase the work that we do with European presidencies that are interested in promoting digital health and data, as well as a series of roundtables that we have been running in the last 2 years. And in addition, we have the second day of what is a 2-day summit, which is devoted to the international project work that the ECH Alliance team does, where again, we showcase innovation in those projects. Last year, we doubled the number of registrations. So we had around about 800 people from 60 plus countries, and a great range of companies and research and universities from across the globe. And we will continue this event in a virtual form because it just attracts a much bigger audience from across the whole of the globe. So it fits in very well with the strategy for the Global Health Connector Partnership.
Thanks very much, Bledden. And we go on to the next one, Heather, which is health. Russ, I don't know whether you're going to speak to this or whether Rich has joined us. If you can do it, fine.
Yeah, so I'm not going to speak for Rich, because although we have a partnership on this event, this isn't a joint event between the two organizations, but we will be running all of our innovation stuff there. And as always, Health runs an amazing event. And I know Anne with ATA and Chime are both partners in this event. And
Yes.
so you can't go wrong with Vegas in November, because it won't be 120 degrees. And so we can all go there and have some fun. Also on there, and I don't think you have this, Brian, is our annual event, similar to Anne's, is actually the week prior, November 7th through the 10th in San Antonio. So that's not on the list there, but again, Health will be partnering with us, as well as Anne and so many other people. We all try to help each other out. So
great, good. Heather, maybe you could make a note and contact Russ on that. Just final word on health itself. I managed to attend pre-COVID the last time they were in Las Vegas, and it was one of their first events, and I must say it was very different from many events which we all attend, and was much more innovative. I thought very innovative and a different approach, and obviously it's going to be popular again. So again, this is another flagship event on our list. And then we come back to you, Anne, if I could briefly, on the December event in Washington.
Yes,
please.
Absolutely. And again, everyone is welcome. This is an event that we do annually towards the end of the year to acknowledge some of the changes that have happened from a legislative and regulatory perspective in the US, and then focus on what's ahead for us from an agenda. I will say, though, that what we've uncovered in our work with all of you is this overlap of issues, and I know we'll talk about that in a minute,
yes,
which require policy and regulatory changes as well, and even things like the FDA here in the US is sort of the Wild West, so you can sympathize with that. So there's much to be done globally, even though it's a US focused policy conference. And so again, look forward to working with all of you there.
Thank you. I think that's it for the moment in terms of actual events. These are some of the locations. That's while they're going up. I'll just you can see where we're gradually extending our reach. Let me bring in Raj, because I know, Raj, you and I are planning something in India. So if you want to bring us up to date on that,
Yes.
please.
Thanks, Brian, and good morning, good afternoon, good evening, and even to our friend from Australia. Thanks for joining. So right now I've received a proposal from the government whom we are talking to, because they launched the biggest digital health program in India. And we're planning somewhere around September timeframe. Once I close on the date, I'll come back to you. But that will be again a global summit where we'll partner with the National Health Authority that rolls out the largest digital health program in India. So that's where we are. But we'll certainly do this around the September timeframe. I'll come back to you on the exact dates.
Right. Well, I know I gather some of the people you were dealing with in government a few weeks back, I know you and I talked, actually had COVID. So there were a few delays in getting there.
I'm in fact down with COVID as well, as I'm on the call. So it's just, everyone gets it as Omicron spreads. So that's how it is.
Well, thank you for joining us. And so this would then create a Global Health Connector event in India. And again, we will keep all of you up to date on that. And I'm conscious, of course, we've got Angela here, who's normally based in Maastricht, but actually is in India for a couple of months, I think, with Helmut. And again, we will look to you, Angela, for advice. And I'm sure Rahendra will as well, while we put together the program for that Indian event in September.
Just maybe very short, Brian, and that is
sure.
Rajendra, if I may say so, in February 2017 in Delhi, we had with your party together with BGP and co-organized by Sarasa Buddha, an event on digital health, where and so maybe to also a little bit build on that. That would be a suggestion.
And can I just say, Angela, that's a great suggestion for this reason. This is exactly what's happening with the Global Connector. When someone's has done something or wants to do something, it's always better, I find, to do it together. I think there are ways we can incorporate those ideas into the agenda in India. So we will certainly be in touch with you about that. Brilliant. Exactly. Thank you for your contribution. Right. So Africa, can I just bring you up to date on Africa? I spoke to Amit Thakur, who, he is there. Amit, you're with us. Do you want just tell it? Apologies, I didn't see you on the list. Apologies. Do you want to do a synopsis again?
Yeah, just tell me on the synopsis. Sorry for joining late, but the synopsis on what exactly, Brian?
You just missed some of it. This is the flagship events. And I know you and I have talked about trying to identify something in Africa, which you're involved in with the Federation and AHP, and making that a global event as well. And I know you're still working on that. I know you don't have dates, but just perhaps you could express your willingness to do that, because you've expressed it to me.
Right. Can I ask a clarifying question? And
sure.
This may have been answered by many people. When we do this calendar of events and flagship events, are we looking for 1-2 major events? And are these events literally going to be on a specific subsection of digital, or are we open to wider events that will rope in digital solutions?
Well, I will try to answer that. The answer is that we're open is the first thing, because I think we have to be open to everything. Secondly, remember, many of these events are already well-established events, such as the ones that Russ runs, such as the one that Rich and Anne and so on. There are others who run these well-established events, and they have their own programs, their own missions. And in those cases, in some cases, we fit in with whatever their theme is and try to amplify it. In the case of Africa, I know from the events we've done together just recently, last week, I think, there are many other topics happening in Africa which are not necessarily happening as obviously around the world, and therefore you may well bring a different spark, different topics to what you might offer in Africa.
Sure. So we're open. If we are open and the team also is open, I would like to suggest something, but I don't know if Angela wants to add a point or two before I answer that. Go ahead.
And did you want to speak? Do you want to come in? Or your hand was up originally. Is it still up or are you?
Sorry, I forgot I was muted. Amit, nice. I wanted to suggest to maybe involve also from EU Africa or from the stakeholder people to help with planning on personalized medicine. And that was an idea to support and join forces.
Thank you.
I think,
Amit, please.
So there are 4 or 5 key Fulcrum events for healthcare that we can get involved in Africa. I think that's where I'm driving to. One is around healthcare itself. The other one is around business of healthcare. The third one is around public policy and shaping the governments and ministries of health. And the fourth one is around scientific papers. So I would say, and of course, there are many more below that. There are 20s and 50s and 100s. But I think if we choose these headline events, then I will say that if we get involved as a strategic partner, which I think is no cost engagement, so that everyone on this call and their ecosystems understands where Africa is going, and vice versa, Africa understands where some of the people on this call are doing some amazing work in their continents. So that's the first step. I hope I've got that correct.
You've got it correct.
So the first one I would like to say is the Africa CDC Champion event called CPHIA 2022. We just finished the December event and we should have been a strategic partner. So I would like to make this Global Health Connector program a strategic partner. So we would get invites to VIP events and things like that without a cost, and your members or the coordinating committee is recognized, and you take the information and amplify it to your ecosystems. So these 4 events, the next one is Africa Women's Health Day.
Yes.
And that's taking place on 24th of February, which is a hybrid event. Dr. Tedros, who is hopefully going to travel for a day, but it has been endorsed and partnered with Africa CDC and WHO, together with about 16 ministers of health, and the countries are coming together. The idea of that event is, are private sector investing as much as needed for women's health? Is women's health being left behind? Is the innovation around women's health helping cancer treatment, reproductive maternal health treatment? And are we collecting data adequately so that we can make an impact? So I think if I was to say we go one step at a time, I would have the Global Connector Health Program to be a strategic partner and bring everybody in. Since it's hybrid, we amplify this event to all the partners and their ecosystems. And those who want to register should register and hear what Africa has to say. I'll stop here and ask Brian if you think it's an idea we should pursue.
Well, first of all, on the first one, we should definitely, the one you just had in December, we should definitely come in as a strategic partner there, Amit. So thank you for the invitation. The second point I'd make on women's health, first of all, it's a worldwide issue, but we have already been working with the Alliance and yourselves on promoting that event. But I think if we were able to promote it now as a Global Health Connector event, we then, all of us can circulate that and hopefully participate in it. As you say, a hybrid event makes it easier to some extent for some of us. So Heather will pick up on this as well immediately after this call, Amit, and we will then promote this to everyone, not only on the call, but all of the other partners and so on around the world. So thank you. That's it for now. That's quite a lot, actually, Amit, as always with you, to the point, very succinct and great. Right, so we have many other events, and I know some of you are already putting in the chat box events that you're involved in. Just to be clear, we can't do everything, right? And we want to be careful we don't just become a list of events organization. I'm not knocking what you're doing, do keep suggesting, but we have to balance it in some ways. But where I would make the distinction is this: we're happy to promote your events through the Global Health Connector and the partners in that anyway. But how to distinguish those from an actual global health connector event is we want to hold a summit and it can be in different ways for certain events. So for example, the ones you saw on the screen at the beginning of the meeting, we will actually have either people physically there, in most cases physically, and if not virtually, to run a global health connector summit. And that will bring speakers from around the world. So we're making this up to some extent as we go along and seeing what people like, but we're beginning to realize there's quite a demand for speakers around the world. So we will be back in touch with you, Amit, well, immediately. And I see you've sent me some WhatsApp information already in the call. So we will follow up on that. So I appreciate your invitations and input. We need to round off this topic, but are there, other than specific events, which I know George, for example, in Australia, is very involved in the aged care sector there as well. Those sort of events, George, you've put on the screen, we will connect with you directly and figure out a way how we can, because you already are a member and we'd like to work with you on some of those. Anybody, because I see, Herco, you've got your hand up, I think there. I'm just looking down. Please, Herco, if you would like to speak now.
Yeah, I don't want to pitch any specific events, but
okay.
So don't worry about that. I want to make a call, basically, that now that we're starting to return to some of these face-to-face events and that we have the opportunity to have unplanned, spontaneous meetings again and true inspiration instead of just consuming content. I think that's, and I think that we have a responsibility there, especially if we, as we're still in this pandemic, even if we're in the hopefully the dying end of the pandemic, but still. So we have a responsibility there that when we meet, we make the most of it and not just do what we did before and go about our business the day after. So I do want to make a general call out to, if you have these flagship events, please define what the desired outcome is and focus on achieving that outcome. Because again, we now everyone experiences how precious it is to have this group of bright people together in this kind of a setting, and what a wonderful resource that is to actually use to advance these topics that we're all in. So that's my general call. Thank you.
Thank you very much, Herco, indeed. George, you've got a point. George Margelis, you've got a point.
Yeah, just a point. I mean,
please.
Brian and Andy have both been involved in some of our virtual events that we've run over the last 2 years due to the fact we've had to not run live events, and now they've been very successful and we've had a lot of interest. But we are working with some of the other local members, in particular RMIT, about building up the Australian local ecosystem. I mean, as you know, Australia has been one of those countries that even throws out the world's leading tennis players, so we're pretty strict about what we do here. But yeah, we're looking forward, hopefully, with things opening up to have an opportunity. And yeah, I also look forward to the opportunity of having another beer with Brian somewhere else around the world, like we used to in the good old days. So.
Indeed, yeah. You introduced a terrible burger joint in New York once. I remember, because you were paying for the meal and you thought it'd be cheaper, and then you found it was actually more expensive. But there you go. So we all.
I was working for an American company. I had to eat in an American joint.
Right. So, any other comments before we move on from this particular topic? We've covered quite a lot. No. Right. So, thank you all for that, and we will send out action minutes from this meeting, and we will follow up on specific areas that we've touched on. And I'm grateful for all of those who are still joining us as we go through. The next topic is the challenges and topics. We want to make the Global Health Connector not just something that connects events. It's one of the ways we can help each other, but also I want to talk to you about suggestions we've had from many people about what we should focus on for 22, possibly 23 as well. And these came from, not from me, but from different council members and indeed many of our partners. The first one which was proposed was this question of disparities globally. And this was proposed pushed particularly by you, Anne, from the ATA perspective, because you're very involved in doing that. Do you mind if I just ask you just have a quick synopsis on what you mean by disparities? Because American English and English are not always the same.
Well, I'm happy to comment on that, and we'll tap Andy as well, who's been an active participant in this group. What we've uncovered is this notion that, you know, a number of populations, folks in underserved and remote areas, are not getting equal access to services that they need to become and stay healthy. What we acknowledge, though, is that this was a problem that predated the pandemic. I mean, we have a pretty horrific track record in the US in terms of, for example, systemic racism. So the focus of this group is to really address this notion of health equity and to eliminate disparities, recognizing that it takes more than broadband and connectivity, which has been a huge policy focus for the government here at the federal level. So we're really addressing a number of elements that we have to go after. And interestingly, in Andy's participation, what we found is that this is not unique to the US, that the haves and the have-nots, the disconnects between those who, you know, the income divide and the health divide, they go hand in hand. So very excited to be working with all, you know, with Andy on this and to engage more of you in this effort.
And if Ahmed, I'm going to ask you to come in on this. We had a very good call last week on the specific question of EU Africa skills. This was our second summit on that with great speakers from both continents. And there was a particular lady there, Professor Agnes, who runs the University of Global Health Equity. Would that be, I think I got the name right. And we've been in touch with her since through Amit's good offices. And I think she's the sort of person I would think, Amit, who could be very interested in working with this disparities group as a theme. Would you agree?
I would totally agree. And she, after the event, also found the forum to be very interesting, as she was able to honestly talk about the skill disparity. And if it's not managed well, it can become bad to worse in Africa. And having a strategic, organized bilateral relationship is the secret, which is totally lacking globally. At the moment, it's the checkbook that is buying the health workers and not the needs.
Yeah, well put. So we will obviously connect through you and directly with Professor Agnes, with you, Anne, and with Andy and so on to build up this theme. And I know, Rahendra, you had various thoughts on that from India the last time we spoke. And I know you've got people there who would be interested in, again, remember, the point of these themes is to give us a focus and then to ask everyone to come in, because many of you are working on these themes anyway, and we just want your input and so on. Rahendra.
Yeah, so Brian, always you bring for the issues which are pivotal to the adoption of digital health. I think Amit has very clearly pointed out that skilling is important, because no matter what you do, there is technical maturity. We have technical solutions, but organizational maturity will not happen if people are not skilled. So I think all the people on this frame are, I think, have a stake in making sure that skills are made to a level. We are doing our bit. I think some of our great colleagues here on the call are on our faculty on the course that we are launching called the Certified Digital Health Professional course. We want to make sure that we do our bit besides discussing on this important platform. And we will be announcing that, formally launching it by March 1st. Yeah.
Brilliant, brilliant. One other thought I had was we need to be, as you can see, our second theme was a question about the digital skills workforce and the whole. That is a huge area itself as well. And there's obviously a crossover between disparities theme and the skills. But I just want to make sure, I'm sure Anne will not let us do this anyway, we don't want to miss the point you make about equalities in terms of whether it's race, religion, or anything else for that matter, which inevitably leads to some of these disparities in the world. So I know, Anne, you want to jump in and say something on that, but it's important we don't just focus only on the skills aspect to do with disparities, in my opinion.
Oh, I completely agree. And I would say that from our end, what we want to make sure happens is that we don't impose so many restrictions in terms of credentials and so forth that will create bureaucratic layers that inhibit innovation, at least in the US right now. We're concerned about that as also.
Right. Herco, have you still got your hand up, or yes, you
this
have,
is a new
please.
hand. Yeah.
Okay.
I completely support these topics. One of the things that I think from the skills perspective and also on the access to digital care perspective is how the accessibility of the technology itself. So we tend to look at the skills of, we need to upskill our citizens or our professionals instead of bringing the technology to them to be closer to their experience and their own processes. So I do think that it needs to be a combination of making the technology accessible as well. And I sort of missed that in this narrative now.
Okay, thank you. Rachel, I'm going to ask you to jump in, given your past experience. Maybe you just briefly describe your experience with the NHS, et cetera, et cetera. So maybe just and get your input to this one, please.
Yes, so I am CEO of the NHS Digital Academy. I've taken a main lead on workforce planning for digital for the NHS, and I'm also inputting into the strategic resource kit for digital health in terms of workforce for digital health globally. There are a few things for me here about workforce and disparity. What we found certainly in the UK was we didn't have representations from our communities, particularly our Black communities and women from certain groups. And what we've created is workforce plan over 8 years. We've found that we've got major gaps still, even with the additional capacity we put on. So we've created a program of non-linear career journeys, taking people from astrophysics, biology and other things and bringing them into healthcare. And so there's some really exciting work that I've been involved with, which actually they're taking over to the US, some of it. And that is going to go into the strategic resource kit for digital health globally that who are putting together as some of the case studies. So it's a really interesting space, but we have disparity in our workforce and we have disparity in the people that we serve, and we need to address both. And actually we need to make sure we're creating jobs for all of our communities and skills within all of our communities. So it's a really complex area, but something I'm hugely passionate about.
Well, I think Anne will be pleased to talk to you because you two are going to be together at your event, Russ, Chime at Vive in Miami. So you can enjoy the good weather, but also find time to build on this whole theme. George, you've got your hand up, or is that an old hand?
Yeah, no, that's, yeah. So obviously workforce is a huge issue down here in Australia as well. And we actually ironically had to postpone a digital workforce event in early March because of the workforce crisis we currently have. Australia's had its first major COVID outbreak over the last couple of weeks. But the government here has committed some $1.2 billion specifically to aged and healthcare workforce. Stronger focus on aged care was because that's one of the major topics down here. But yeah, I mean, work for digitizing aged care is an area that we're looking at. But without a workforce with digital skills, it's a challenge. And I'm sure, like everyone else, there's competition for digitally enabled workforce across all sectors. So we're struggling. So we're really keen to work with you guys. And I think Andy's pointed out the RMIT are part of that group working with the Skills Thematic Innovations Forums.
Yes, we have the Alliance has its own. Andy, do you want to I'll come to you, John, just a second, if you got your breath back from all your walking. But Andy, do you want to just briefly describe the thematic ecosystem we have within the Alliance?
Yeah,
just briefly.
We kicked off last year a new series of thematic innovation ecosystem, the first of which we targeted was skills and health skills. And what we've done, we've planned with our Danish and Australian ecosystems led by RMIT and the South Danish ecosystem, a series of gatherings targeting carers and citizens, because we all assume they're going to get people to do self-monitoring and they don't know how to use the tools we've asked them to send the results in. Then looking at workforce, then looking at training up skills professionals. And those are, I think, an ideal opportunity for you, to take part, join in, share best practice, and also need, because we're trying to bring there a real clear distinction between what the needs are, and you'll see that in the event we've got coming up in February, and then what does good look like. So that's an open invitation for colleagues here. the link's in the chat function below you.
Okay, good. John from the States.
Thanks, Brian. Just a quick one, really. I don't want to turn it into a book club, but given Anne's suggestion around health equity and just equity in general, wonderful little book called The Lies That Bind. Not the ties that bind, the lies that bind. Wonderful background. It really gives a fabulous contextual picture because inequities run very deep in terms of assumptions and bias and all sorts of other things. Worth reading as a base foundational text, I found. So just thought I'd suggest it.
Thank you. Clayton, I'm going to surprise you and bring you in, if you don't mind. Do you want to, first of all, introduce yourself, and then maybe, because you and I talked a few weeks back about the question of skills and all the other issues to do with workforce and whatever. Do you want to just jump in, introduce yourself and touch on this question we're discussing about disparities and so on?
Sure, thanks, Brian. It's really a wonderful opportunity to be part of this meeting. For those of you who don't know me, my name is Clayton Hamilton, and I'm responsible for digital health at the WHO Regional Office for Europe. So a lot of what you're talking about in terms of inequities, and in particular within digital, are really our bread and butter. We have an office actually in Venice that specializes specifically on health equity. And it's recently combined with a program of gender to really bring those two areas together, which makes a lot more strategic sense. So a lot of what we've seen during the pandemic, and I think it was Anne that said before, a lot of the inequities predate certainly the pandemic. But the social determinants of health thinking is not new. But what is new is the fact that with the uptake of digital technologies, we're seeing a whole new spectrum of inequities actually arise, and a whole new spectrum of the causes of what behind that inequity, but also in terms of the impact. So it seems to be very much a downward spiral. Those people who are least or most vulnerable in the population are least likely to have access to digital solutions, and so that spiral keeps descending. So we're actually currently in the process of really trying to bring together some thinking about, well, we talk about this a lot. And I mean, just over in the last 2 years, I mean, it's been one of the kind of the key themes going throughout discussions. But what do we do about it? What do we mean if we really want to get concrete about this for the digital health community? How do we design solutions that take this into account? So that's the type of thinking that we love to tap in from this particular group, and really share a lot of what's already been done. There's been some great work coming out of Wales in the UK and in the Nordic region as well. So just really to flag, there's a lot that's already there that I think you can capitalize on and actually bring then to a global audience. So really lifting up that. And of course, anything I can do in that, I'm more than happy to help. Thanks, Brian.
Brilliant. And I think, again, you've illustrated the fact that I'm convinced that just about anything we decide to do, someone somewhere is already doing it. And we can amplify and encourage that to be a more global view by getting input from the many people who have effectively volunteered, even on this call, to be part of this disparities group. And so you're going to have your hands full dealing with all of this lot. But nevertheless, the enthusiasm, the knowledge and experience is there, and the need is there. So we leave you to do that. We then obviously touched already on the question of digital skills. And there we've got a lot of experience, all of us. And again, I need each of you, each organization on this call and others, to think about what you're doing about that already. Because what you're doing about that already could be really valuable to other people. So don't keep it a secret. You know, people tell me often how wonderfully, and some of them are doing amazing work. And I say, have you signed the Official Secrets Act? And they say, why? And I say, because you haven't told anybody else about it. And so we are capable of disseminating that information and finding real partners. So I would encourage that. And just on the digital skills workforce, Professor George Crooks, who's not able to be with us today, is very keen to be very involved in building that theme globally with all of us. So again, I'm quite sure that, because I know many of the organizations on board here, for example, I see Frederick there. I know you do a lot of work in this area along with Rahendra and so on. Do you want to just give us your quick view on that, if you're still online, please, Frederick?
Yeah, yes.
And welcome.
Thank you, Brian.
Welcome. Good to see you.
Good to be with you. Yes, indeed. Within the International Society for Telemedicine and eHealth, skills and well, training and educational offers and activities and initiatives are indeed part of what we're looking at. And actually, this is well, there are new and upcoming developments there, which are actually being led by Jefferson Fernandez, who is also